He's also the director of UCL Partners Integrated Mental Health Program. He's chief executive of the Anna Freud Center. He's national clinical advisor for the IOPS program for children and young people. Somewhere along the line, he collected an OBE. We all keep a very close eye on the Queen's birthday list whenever he comes around, because hopefully he should be going one step further, but I shall stop there and hand over to Peter. Thank you very much, Peter.
Thank you very much, Professor Schiel, and it is an honor to be asked to speak at this incredibly important event, because you do have a very special angle on something that very close to my heart and very close to, I think, the heart of all those who are in the mental health professions, in the caring professions, but also are very aware of mental health problems in themselves, as I've had, and I think it's fair to say the majority of us probably have had experience of distress that could be diagnosable, whether it was diagnosed at the time or not. Now, we all know that SARS-CoV-2 is the most threatening, life-shattering event impacting on humanity since World War II. It, in fact, may take more lives in many countries than the global war. It has shown, I think, human capacity for adaptation and a capacity to respond with unbelievable flexibility that I think, in a sense, makes us proud to belong to our species. Not many other occasions for this, particularly in the light of global warming. But within this, there is a very special issue about care workers' well-being and why healthcare workers deserve to be a special subject of study, as you will make it a subject of study in today's conference. And I can think of 4 reasons for this. First, it's a moral imperative on all our parts to document the impact that these unusual circumstances have on a group of people who have unusual exposure. And I can go into that in a moment in more detail. So it's the moral imperative that we actually try and find out, well, what is going on with this group of people who are putting themselves in line, in the firing line of very real and very genuine danger. But it's also something that's in a kind of self-interesting initiative, because they are looking after us. It's in our best interest to make sure that they are in the best position that they could be to exercise that function. But I think perhaps more importantly, they deserve our effort to identify better ways of protecting them, both because of the moral imperative and because of our best interest. If we can make a contribution to actually improve the conditions that they work under, then we should make sure that that's the case. And finally, there is a scientific reason, and the scientific reason is understanding resilience, because as you will hear probably from the presentations this morning, it's not absolutely clear that the incredible pressures that they have been under of increased risk of infection, of workload changes, reassignment, sleep deprivation, the loss of colleagues, less than adequate settings that they were forced to work in, insufficient access to PPE. If any of these things actually made as much of an impact on them in terms of the manifesting of common mental disorders as you might have expected. So there's something here to understand about resilience. What is it that enabled healthcare workers to perform a dangerous but essential role, which they were engaged in, with courage and with resilience? What is it? And to me, that's a really important question that perhaps more than any of the other reasons I mentioned makes healthcare workers a special subject of studies. Because whatever it is, I want something of it. There is one further issue that I want to raise, which is not a popular subject, and that's the issue of moral injury. And it is clearly the case that the conditions under which healthcare workers had to function frequently violated the common moral code that we all function under, which is something that in itself is a source of distress. That they have, in many instances, been betrayed by their employers or by others outside the healthcare service who treated them with insufficient respect, who they once trusted, and who violated their own moral codes or values. But also that many health workers saw things that they felt were morally wrong. And it is this that I feel is perhaps more than any of the other aspects of the exposure of healthcare workers that is perhaps a special subject of study for this group that is concerned with stigma, which inherently is associated with moral injury and the breaking of moral codes. So I think I have to declare an interest. Both the female members of my family, my wife and my daughter, were healthcare workers throughout the pandemic, and they were in the front lines. My daughter actually acquired COVID. She's a paramedic, but she went back as soon as she could. I think I should also mention that in her station where she works, there were 9 in a station of over 100 paramedics, 9 who did not go back. I think the Queen was appropriate to attribute to this group a special award. And from my point of view, everyone in the profession deserves a special award. But I just hope that my wife and my daughter actually are able to experience the gratitude that I and many, many others feel. If that gratitude could be matched by ways in which the financial difficulties that they are in, the infection and death of their loved ones and the loss of social support they experienced can be in some way compensated, it would be, I think, something that would do benefit to my own moral injury. So thank you very much. And on behalf of the Division of Psychology and Language Sciences, I hope that you have an excellent meeting. Thank you, Professor Skior, and good luck.